A day set aside to honor historic sacrifice disrupted as the pandemic takes a new toll on a generation that's already given so much. I'm Adrienne Arsenault.
And I'm Andrew Chang. Tonight, finding different ways to honor Canada's veterans.
Age shall not weary them, nor the years condemn.
Smaller ceremonies, creative tributes, and the one vet who couldn't stay away.
Plus, CBC News uncovers a deadly new COVID outbreak at a long-term care center in Alberta, and doctors sound the alarm about the strain on hospitals.
COVID patients are going to overrun our healthcare system.
Short-term pain, long-term gain. Does the so-called circuit breaker lockdown work?
And combating COVID by rethinking ventilation.
It actually sends out UV light into the duct system.
This is The National.
Today, it was harder than usual to pay tribute to those men and women who have served and sacrificed.
It was perhaps hardest of all on our oldest veterans, part of what's called the greatest generation, now at risk again from a deadly threat.
Canada's new period of national sacrifice demanded some restraint on our Day of Remembrance. Smaller crowds, for instance. This in a year when Canadian soldiers jumped into action to help vulnerable residents of long-term care homes. Ashley Burke shows us the necessary changes to the ceremony, but also how those restrictions couldn't stifle the spirit of this day.
The ceremony smaller, but no less somber, no less significant.
Today we are not at war, but we are in a battle for our individual and collective health and well-being.
That battle has claimed more than 10,000 lives in Canada and forced organizers to scale the ceremony back dramatically. Only 100 invited. Solo singers rather than a full choir. And no Veterans March, only a small group to represent those now in their 80s and 90s whose age makes them vulnerable.
I go back in time and think about our men who served in the Second World War and our losses in Korea.
George Slade wasn't invited, but the Korean War vet couldn't help but show up, even if it meant paying his respects alone in a lawn chair from across the street. A poignant illustration of the year 2020.
We got to honor the veterans.
Further away, only a fraction of the usual thousands who packed the streets.
This year feels much more quiet, somber, a bit eerie, but also more peaceful in a way.
Just being here feels very important.
Other ceremonies across Canada were similarly distant, as fear of COVID-19 kept most veterans away and all people apart. In Ottawa, only a few wreaths laid as part of the ceremony, including one by this year's Silver Cross mother, Debbie Sullivan. Her son, Lieutenant Chris Saunders, died on board a submarine in 2004.
We acknowledge them all for their sacrifice and their service. It's all about our freedom.
Veterans who've already sacrificed so much, now forced to be wary of the ceremonies that honor them. Ashley Burke, CBC News, Ottawa.
And we will have more special Remembrance Day coverage for you later in the hour. But now let's turn to how the COVID landscape has changed in the country today. Quebec posted nearly 1,400 new cases with nearly 600 people in hospital right now. Ontario surpassed 1,400 new cases, setting a new record. It's got more than 400 people in hospital. Manitoba reported 431 new cases today, its third highest tally yet. It also set a new hospitalization record. And in Alberta, 672 new cases with just over 200 people in hospital. And late breaking tonight, CBC News has learned that province will announce new COVID-19 measures tomorrow, with cases surging, calls for tighter restrictions growing, and Alberta now reporting a record 46 patients in ICUs. Carolyn Dunn has the exclusive details.
Until now, the Alberta government's message has been this.
Take a minimal impairment approach to the exercise of people's constitutional rights and to their right to take care of their families and have financial security as well.
But with COVID cases surging, CBC News has learned the Kenney government held an impromptu cabinet meeting today to weigh their options. On the table, limits on social gatherings and worship services, and reducing capacity or operating hours for businesses. Off the table, a full lockdown as the number of patients in hospitals and intensive care units hit record highs. A group of prominent doctors is urging Alberta to implement a 2-week short, sharp lockdown or circuit breaker, then turning to targeted regional control measures.
We estimate numbers are doubling about every 10 days. And if this continues, the numbers of COVID patients are going to overrun our healthcare system.
And as community cases surge, officials battle a deadly outbreak in an Edmonton nursing home. In just 3 weeks, at least 10 residents from South Terrace Continuing Care Centre have died of COVID-19. More than 70 staff and at least 85% of the residents have caught it, including 79-year-old Richard Steiner, who has advanced dementia and was diagnosed today.
I just see him alone in his bed. Alone in his bed, sick, and nobody that he knows or loves being able to be.
But the tipping point for the Steiners to go public was concern about the level of care.
We were told verbally that they could be in their bed for 2 days and that bathing may have to be forgone or postponed while they attended to more urgent medical needs.
Rivera, which runs the care home, says with help from Alberta Health Services, it has brought in a variety of healthcare workers. Carolyn Dunn, CBC News, Calgary.
There is a similar effort happening in Saskatchewan, where more than 300 doctors have signed a letter demanding more action from the government.
The approach seems to be that we're doing okay and we're going to be able to handle it, but I think anyone looking at those numbers knows that eventually we will be overwhelmed. We can't keep that up. That's not sustainable.
And indeed, Saskatchewan has seen record cases and hospitalizations this past week. The health minister thanked the doctors and said the government will continue to follow advice from public health officials. So we've heard doctors calling for a so-called circuit breaker lockdown, short, intense lockdowns closing just about everything in order to stamp out the spread of the virus. But as Christine Birak found out, many experts say short-term pain may not be enough for long-term gain.
The record-breaking speed of COVID infections can only be slowed down by keeping people apart. To do that, health officials are creating this patchwork of so-called red zones, lockdowns, and circuit breakers.
Theoretically, they should work for the sole purpose of getting your numbers down lower.
Experts say there are no set definitions, but lockdowns generally last a month or longer. Circuit breakers can be planned ahead of time, and they're shorter. BC's Lower Mainland is trying 2 weeks.
Even 2 weeks should be long enough to interrupt a lot of the transmission and make a significant indent.
But other experts argue it's not enough time.
2 weeks, if it works, it's going to drop the level that much. And then a week or two from now, you're going to be right back where you were.
A recent modeling study across 131 countries estimated a full lockdown, including school and workplace closure, could reduce the average number of people that one infected person will pass the virus to by 42% on day 14 and by more than half on day 28.
Honestly, if you really want to cool things down, it's a month, with a possibility of a repeat month after that if things don't cool down enough.
He adds governments need to invest in testing, contact tracing, and isolation measures. Otherwise, businesses will be repeatedly asked to shut down. This report from the International Monetary Fund notes lifting lockdowns is unlikely to lead to a decisive and sustained economic boost if infection rates remain high.
At the end of the day, what you need to do is first you control the virus, then you can get your economy back. It doesn't work the other way around.
And experts say while a circuit breaker type lockdown may slow the virus down, it won't be under control, and hospitals could still end up overloaded. Christine Birak, CBC News, Toronto.
Now, hard-hit Manitoba is throwing that circuit breaker tomorrow. The entire province will be considered a red zone after setting another unwanted record today. 9 deaths, the highest yet. 54 Manitobans have died in just the past 11 days. That's more than we saw in the entire first 7 months of the pandemic. But consider Canada's hardest hit province overall. Quebec's death rate is right now actually just a fraction of what it was during the April peak, but it has nonetheless climbed sharply. More than 700 since schools reopened, with another 22 today. Alison Northcott takes a closer look at that province's effort to keep people safe.
He turned 89 years old in June. He was a very, very healthy man.
But on Thanksgiving weekend, Angela Yasenza's father, Pietro, started feeling feverish and achy. He tested positive for COVID-19 and died not long after.
Took us by surprise. We didn't expect this at all.
During the first wave, as the virus spread furiously in long-term care homes, deaths in the province soared, sometimes reaching more than 100 per day. Now, deaths are climbing again, with 22 reported today.
The elderly, again, are the ones who are the most vulnerable to severe, life-threatening COVID.
But Dr. Donald Vinn says so far the second wave has been less deadly than the first, in part because it hasn't hit long-term care homes as hard and because healthcare professionals know more about the virus this time.
We didn't have some of the weaknesses that we saw in our first wave. We had the personal protective equipment. We had an increase in the number of personnel. We had reorganization of our hospital and our clinical services.
Recent data from Quebec's Public Health Institute found fewer people who get sick from COVID-19 are dying from it. And some experts note the mortality rate is going down across all age groups.
And we're not sure why. Potentially because we've changed how we are managing cases. I think we've learned a lot about the disease since the spring.
Still, overall, Quebec has had more deaths than any other province, more than 6,000 since the pandemic began, compared to more than 3,000 in Ontario.
If you have the virus circulating amongst the older segments of the population, you're going to have a higher mortality rate.
Even with thousands of businesses closed and private gatherings banned in many parts of the province, Quebec is still seeing more than 1,000 cases a day.
We need to really be careful, take precautions.
For her family, it means holding a much smaller funeral for her father than she knows he would have wanted. Alison Northcott, CBC News, Montreal.
The COVID-19 death toll in Ontario long-term care homes now exceeds 2,000. Today, families of those sickened or killed by the disease asked the Ford government to alter a bill that could make it harder to sue those homes. Magda Gabrisalasa shows us their concerns.
That's my mom about a year ago.
Mary Lou Kennedy in Toronto says the pictures of her mom before and after COVID say it all.
Before COVID, she was independent, she was lively, she was full of life. Now she's basically a shell of her former self.
Her mother lives at Grace Manor in Brampton. Kennedy says she contracted COVID there and was hospitalized for 2 months. She lost weight, her dementia became worse, and she now needs a wheelchair to get around.
Obviously,
Trung Do and his family are in mourning. His father had been living in Erin Mills Lodge in Mississauga when he became ill in April.
Less than 12-hour period from them telling me that he had a fever and him having no vital signs.
Both Doe and Kennedy have joined a class action lawsuit against a list of long-term care homes, but they're worried about a proposed Ontario bill. Bill 218, supporting Ontario's Recovery Act, would protect businesses operating in good faith from being sued if people catch COVID. Advocacy groups say it could shield long-term care homeowners from accountability.
To allow the home operators to be indemnified against for liability for their negligence and their gross incompetence is beyond any moral code that we have as a society.
The government says that's not the case, that the legislation won't protect bad actors from repercussions for gross negligence. But a lawyer representing the family says proving that is a difficult task.
Gross negligence is going to be what the courts define it to be in the context of the long-term care industry. There are no precedents.
The company that runs Doe's father's care home says they're sorry for the losses of families, but can't comment on specific cases, and they're focused on providing the best care possible. Magda Gabrisalasa, CBC News, Toronto.
Well, the United States has hit another record high in daily new coronavirus cases, more than 145,000 today. And at the White House, more staffers have tested positive. But instead of focusing on fighting the virus, David Common shows us the Trump administration remains focused on battling Joe Biden.
Barely a block from the West Wing, the unofficial White House gift shop has accepted what Donald Trump will not, the results of the election. Joe Biden as incoming president, his inauguration coming. Trump may never do the same, and few Republicans are challenging him, like this Philadelphia city commissioner who's now facing death threats.
One thing I can't comprehend is how hungry people are to consume lies and to consume information that is not true.
At this point 4 years ago, Trump was already getting access to intelligence briefings, money to hire staff for the transition. Same thing 8 years before that, but now the organs of government have been ordered to not even talk to the Biden team. So that team stays in Wilmington, not in Washington, without access to key information, unable to vet cabinet picks or draw funding to form government. Even as the Trump campaign files a lawsuit in Michigan alleging irregularities and unlawfully cast ballots, the New York Times contacted election officials in all 50 U.S. states. Not one found evidence of fraud that would change the outcome. And yet, most Republicans are unwavering in backing Trump.
You know, the president wasn't defeated by huge numbers. In fact, he may not have been defeated at all.
By continuing to insist the election is not yet over and that he somehow is going to win it, Trump is galvanizing his support on TV, in social media, and in Congress. And now he's unleashing a new weapon to hold power, the government itself. David Common, CBC News, Washington.
People in Florida's west coast are bracing for Tropical Storm Eta. Several regions are under a state of emergency. That storm is expected to make its fourth landfall tomorrow after it already slammed parts of Central America.
Canada is condemning China's latest action in Hong Kong. Earlier this week, Beijing granted the territory's government authority to toss out lawmakers considered not loyal enough to the Communist Party. Now others are resigning. Thomas Daigle on what it means for the pro-democracy movement.
They may be headed for the door peacefully, but make no mistake, these 4 Hong Kong pro-democracy lawmakers are being kicked out. A result of Beijing authorizing the dismissal of dissenting voices. There will be no more support of Hong Kong independence allowed in the legislature and no questioning of Beijing's power.
You can voice opposition as long as it doesn't affect the sovereignty of the central government.
The new crackdown comes exactly 1 year after some of the most violent confrontations between police and protesters over China's tightening grip.
We need to take concrete action to show to Beijing that there will be a price that they have to pay.
Now, a different kind of protest, with the remaining pro-democracy legislators resigning, all of them, in defiance of what they see as Beijing's latest power grab.
We say today is the end of the one country, two system.
On Hong Kong's Legislative Council now, the pro-Beijing camp will have virtually no opposition. Leader Carrie Lam appeared amused by the mere suggestion they'll rule unchallenged.
I wouldn't say that for members remaining in the Legislative Council, we will have a rubber stamp legislation.
There's little doubt, though, Beijing appears increasingly emboldened. Just ask Nathan Law, a former Hong Kong legislator. He fled to Britain this year.
The separation of power in Hong Kong is officially ended.
Even over a poor connection, his sense of dread is apparent.
For now, people are just thinking about different ways, thinking about methods to strengthen and to maintain the momentum of the movement, which, to be honest, is quite difficult.
For activists like him, the resolve remains, but the options are dwindling. Thomas Daigle, CBC News, Toronto.
The UK has crossed a new and terrible threshold as it struggles to contain COVID-19.
Every death is a tragedy.
Next on The National, 7 days into a national lockdown, confusion and frustration.
What I'm going to show you over here is going to be our HVAC system.
A critical tool to fight the spread of the virus that's about to become more important than ever.
we're going to eventually have to close the windows.
And the handmade tribute to our veterans that's stopping people in their tracks.
What does it make you remember?
The tears. Thousands of tears.
A labor of love for Remembrance Day. We're back in 2.
Every death is a tragedy, and we mourn everybody who's gone, and our feelings are with their families and friends as well.
Boris Johnson reacting to a terrible number today. The UK has now seen more than 50,000 COVID-related deaths. And the UK is the first in Europe to pass that milestone and just the 5th to do so worldwide. It's one of the reasons the country is back in lockdown. Margaret Evans takes us through the first week of their second shutdown.
1 week ago today, and England was counting down to its second lockdown of the year. But this one isn't like the one in March. Just look at the difference then and now. For one thing, the schools are staying open this time. But there are also fears that people just aren't taking the rules as seriously now.
I think everybody knew what they had to do during the first lockdown, and there was very high compliance with that.
Public health expert Paul Hunter says government messaging has been less consistent since then. He also says the UK's promised world-beating test and trace system is a failure.
If you're not getting to enough people, and the people that you are getting to them are more likely not to actually follow your advice than to self-isolate, then it's not ever going to have much of an impact.
Let me spell out the medical and moral disaster we face. The sick would be turned away.
The British Prime Minister Boris Johnson announced the latest lockdown on November 2nd, just 2 weeks after lambasting the opposition leader Keir Starmer for backing one.
He wants to turn the lights out with a full national lockdown.
There have been a series of government U-turns recently, including the last-minute extension of a furlough scheme after thousands of people had already been let go.
Marcus Rashford on a hat-trick!
But none have been as eye-catching as the government's headbutting with the footballer Marcus Rashford over school lunches for kids in need. This is Tower Hamlets, one of London's poorest boroughs. Last month, the local university stepped in to cook vulnerable kids' lunches when Downing Street refused to extend a school lunch program into the holidays.
Lots of different businesses around here are sort of helping out as well. Marcus Rashford, the footballer, tweeted about Queen Mary giving out the food as well, so it's sort of gone global. Thank you so much. You're very welcome.
The Man United player depended on school lunches himself growing up in Manchester. He's led a relentless campaign to ensure kids don't go hungry in lockdown or on school breaks. Kids like 16-year-old Kada.
Yeah, it's the government's job, but he decided to use his fame to step in and sort of help younger people.
He's also shamed the government. Just this past weekend, Johnson called Rashford to withdraw his hard refusal of the past few weeks, announcing new funding. As for the lockdown, it's due to end on December 2nd if the infection rate slows enough.
Really do appreciate it. Thank you so much.
You're very welcome.
Margaret Evans, CBC News, London.
Well, next, a closer look at ventilation and how key it is in stopping the spread of COVID-19.
We know that some particles will remain airborne forever. They will never settle down.
What the science says about the risk of aerosol transmission and why experts say it's time to rethink how we clear the air.
And he may not have been able to march in the Veterans Parade this year, but a parade came to him for his 100th birthday.
Well, as colder weather sends us indoors, Canada has revised its guidelines on how COVID-19 spreads. They now include the risk of aerosol transmission. Researchers have been warning about it for months, and it means simple physical distancing may not be enough. So here's Joanna Remiliotis on how some indoor spaces are working to improve their air quality.
Come on, everybody! You got it!
At a boxing club, it's all about staying on your toes, and these days, keeping up with an invisible opponent.
Back to the combo. Up top, man on. Let's go. Jab, jab, cross.
Here they're fighting COVID-19.
Cross, let's go.
One jab at a time.
Where I'm coming from is that as a business owner, it's in our best interest to do everything we can.
You pass. Get on in here.
From temperature checks to limiting capacity and the usual masks, owner Brian Castillo is doing all that and more. Not only does the equipment at his 9-round club in Toronto get disinfected non-stop, so does the air.
So if you come on down here with me, what I'm going to show you over here is going to be our HVAC system, essentially.
Castillo has installed a gadget to his ventilation system, and he says it's as close to a knockout punch as it gets.
We put in this little device here, which makes a dramatic difference. It's a UVA filter, and what it does, it actually sends out UV light into the duct system, which kills mold, bacteria, pathogen, and viruses. Okay, it'll purify the air up to 99.99%.
As a member of a provincial sports organization, his club has remained open in a limited capacity under its guidance. And Castillo says he can't afford to take any risks.
Why did you do this, though? Why take the extra step?
Our livelihoods depend on this. So what I was doing is just following along in other countries that are actually doing well and what they're implementing and what they're doing and what some gym owners have basically shared and said what works. And what they're saying is a simple little device like this is doing the trick. And this is something that I did myself to ensure that my clients have the best facility possible.
The idea is to kill COVID particles in the air before they're inhaled. Not just virus found in big droplets like when people sneeze, but in tiny ones too, called aerosols. Those are expelled by simply talking. There is growing evidence those aerosols can travel well beyond a 6-foot distance and linger in the air.
It could be a few minutes, it really depends. It could be a few seconds and someone has the time to inhale it, and it could be hours. And we know that some particles will remain airborne forever. They will never settle down. So it can be from a few minutes to forever.
Caroline Duchesne is a professor at the Université Laval in Quebec City. She's also a bioaerosol expert. These images were taken early in the pandemic, when she and her team started taking air samples from outbreak settings like hospitals and long-term care centers to study how COVID-19 can spread in the air in aerosol form.
When the pandemic started, I remember reading several reports about people wondering if it would be possible to catch the virus outside when walking beside someone who has the disease. And I think with the air movement and the very rapid dilution of the contaminants outside, it's not a very big issue. But for indoor air, ventilation has to be addressed as a major part of the infection control. And there is more and more evidences that the major outbreaks and the super spreading events that happened so far happened indoor in poorly ventilated spaces.
Those super spreader events have been scrutinized from the start. One of the earliest ones in a restaurant in China in January. An infected person at table A who did not have symptoms not only spread COVID to 4 people at the same table, but to 5 customers at surrounding ones. The theory is air conditioning currents move the contaminated particles across the room. Since then, several more case studies found the same alarming evidence, prompting 239 scientists from around the world to write an open letter to the World Health Organization in July, urging the agency to recognize that airborne transmission of coronavirus by smaller aerosol particles is possible. Duchesne was among those who signed that letter to the WHO.
Why was that important for you to do that?
I think when people start speaking the same language, then it becomes obvious that ventilation has to play a role. So this letter was really to bring that to the attention of the decision makers and policymakers, that this aspect of the transmission control was neglected so far.
The WHO officially recognized the risk shortly after. The U.S. Center for Disease Control and Prevention did the same in September. The Public Health Agency of Canada just followed suit last week.
We thought the quality of the air was a factor that we wanted to at least address among many
But James
other things.
McKinnon acted well before that. McKinnon is the principal at St. Michael's College School in Toronto, And for months, he's kept track of what the science has been saying about aerosols.
We're listening to anybody who wants to share with us new ideas. But at the end of the day, it's really about mitigating risk. And we felt that it was a worthwhile direction to go to really keep our staff safe, as well as the students and their families when they go home.
The school has taken every precaution: hand washing stations, thermal body scans, masks, and distancing. Clean air was also a priority, so the school invested in that too.
My understanding of the units that we have certainly is that there's a 99% kill rate for bacteria and viruses, including COVID. So the standard's quite high. Our units recycle the air in a classroom anywhere from 5 to 10 minutes.
So that's a pretty significant measure to take.
We think so, but we think it's worthwhile. I mean, we'll do what we can. We also have work to do around keeping them connected at school and learning at school. We know the value of trying to keep schools open, so we'll do what we can to make that happen.
Keeping the windows open helps. But public schools are also trying to do more to improve indoor air quality. There is government funding earmarked for ventilation, but with so many aging school buildings, upgrades will take time. This recent donation of portable air purifiers is a welcome fix. Hundreds of the units have been distributed to schools in communities with higher COVID rates.
This helps a great deal because we'll be able to put an air purifier in every single one of our classrooms with kids, so that's going to definitely help us throughout the winter.
Gord Young is the principal at Charles E. Webster Public School in Toronto. His school was the first to get the donated air purifiers.
We've been looking at our air quality since before we came to school. That was one of the big concerns because it's an old school. And so we're opening the windows right now, but the weather's changing, and so we're going to eventually have to close the windows. So this is a really important piece to the puzzle.
Back at the club, the fight against COVID is in the early rounds. And Castillo says he's bracing for more.
4 push-ups, all right? Always rather err on the side of caution. If there's precautions we can take, we'll take them, even go above and beyond if we have to. Mainly because the data is changing, I'd rather go above and beyond and ensure that we're doing the appropriate things than feeling overconfident, maybe slacking a little bit.
You got it, good.
Because with so much at stake, he says, he can't let his guard down. Joanna Rumiliotis, CBC News, Toronto.
When we come back, the small town team that turned Remembrance Day into a labor of love, and the window display that left passers-by both intrigued and inspired. An iconic landmark lit in tribute. Those are 117,000 virtual poppies cascading down the Peace Tower, one for each of Canada's fallen. The poppy is the enduring symbol of remembrance, and in this year of scaled-back ceremonies, a small team in Northern Ontario took inspiration from that symbol and turned it into the very fabric of a one-of-a-kind tribute. Nick Purdon shows us how.
Remembrance Day to me means that I get to live in a country that I'm free. I can get up in the morning and not worry that my children are safe.
Usually Julie Gaume makes mosquito-proof clothing for her company called The Original Bug Shirt. But for months now, Julie and her staff have been working on something else as well. Something from Remembrance Day.
I felt that this year being everything surrounded around COVID, our whole lifestyle has changed. And I felt that Remembrance Day is not going to be what it always has been. We're not going to have the crowds. We're not going to have the services. None of that's going to happen.
You're catching up to me. I'm lollygagging.
So Julie had an idea she hoped would make it possible for people here in Powassan, in Northern Ontario, to still pay tribute to veterans.
So if we bring this in before we put the black on them, it's going to create that effect that we're going for.
Julie decided to make a dress entirely out of poppies.
Yeah, so it's going to look more like the petals. Perfect.
And during the more than 300 hours it took to make, the women had time to reflect.
The sacrifices we're making now because of COVID is a lot less than what a lot of people have made.
Absolutely. Our generation and the generations to come don't even know what war is. So it's more important than ever now to remember, because we don't know. We have the incredible privilege of not knowing what it's like to live through a war and to say goodbye to our family members and not know if they're coming back.
Once the dress was finally finished, Julie put it in her store window. To complete the display, she added an Air Force uniform as well. Then she waited. She had no idea how people would react.
Yeah, all the poppies. That's like the ones that you're doing at school, eh? Yeah. When they're looking at that dress, we want people to stop, to pause, and to reflect on what Remembrance Day means to them.
Yeah.
That's a lot of poppies on there.
Yeah.
Can a dress made of poppies help people remember our veterans?
Do you know what Remembrance Day is for?
To remember people that died.
You're right. Died doing what, though?
From the war.
Yeah. Do you know why they were at war?
No.
No. They were fighting for our freedom. So they risked their lives for us. So that's why we have Remembrance Day every year.
As we age and as younger generations come up, if we don't continue to share how important this is, it's going to get lost.
Absolutely gorgeous.
And it's not just civilians who stop and gaze at the dress. Meet Kathy Bilodeau.
I'm a military person. My dad was a military person. My husband was a military person. I have a lot of pride in serving my country, and I miss it. You know, as a veteran, you never stop serving your country. Brings a lot of pride. So to see this and to see the respect and the love that went into this beautiful display, it just touches my heart.
As the day ends, the dress and the soldier remain, lit up as an ongoing tribute to our veterans. But the next day I witnessed the full impact of the poppy dress when Dan Taylor stops to take a look. Dan's father fought in World War II. His grandfather died in the Battle of the Somme in World War I.
I miss him. I miss my dad. And this time of the year is hard.
What does it mean to you to see this dress?
I think of 1,000 other veterans, 100,000 other veterans, 500,000 veterans who have died in battle. And at this time of the year, it's Remembrance time.
What does it make you remember?
The tears. Thousands of tears in my lifetime standing with the troops and seeing civilians crying, soldiers crying, just like I'm too. It's too emotional.
Dan says Remembrance Day will be harder for him this year because of the pandemic. He'll miss the tributes and the crowds. And maybe that makes what Julie and her staff created here even more important. A place for everybody in her hometown to pay tribute to Canada's veterans. Nick Purdon, CBC News, Powassan, Ontario.
Tonight, we are also noting the passing of Canadian Army veteran George Chow. He died last week, the day after his 99th birthday. Chow was one of the roughly 600 Chinese Canadians who served in the Second World War, and he spoke about his experiences often to CBC News.
Lost some friends in Dieppe. I lost them in Germany and France. The fellow I used to go to school with, he was captured, was a prisoner of war. But those are the bad things, you know.
Chow served on a gunnery crew landing on Normandy after D-Day. At the news of his death, Defense Minister Harjit Sajjan tweeted, Chow was a trailblazer who broke barriers. More special Remembrance Day coverage ahead on The National. We'll be back in a moment.
I'm Jamie Poisson, and tomorrow on CBC's daily news podcast Front Burner, a story that has everything from dossiers on journalists to fictional wolves. We're talking about the Canadian Forces and propaganda. Subscribe wherever you get your podcasts.
A Second World War veteran who regularly spends Remembrance Day at the National War Memorial wasn't at today's ceremony, kept away, of course, because of the pandemic. But despite the added hardship, 2020 still holds special meaning for him. Our Hannah Thibodeau has his story.
For more than 20 years, Robert Spencer attended the National Remembrance Ceremony in Ottawa to mark the war that defined his life.
I think it's very important. It's part of our history and it governs our future.
Now there is another important event that defines him. What would you say in your 100 years is your biggest memory?
Oh, God. Today.
Happy birthday! Thank you from the Netherlands.
A parade for Spencer, who turned 100 on November 9th.
Thank you.
Love you. Members of Spencer's former regiment, family, and friends held a socially distanced celebration. Explain to people what it's like to be 100.
You're grateful you made it.
In 2019, Spencer returned to Normandy, where he landed when he was just 23, only weeks after the D-Day landings. He had many close calls during World War II. On one occasion, his tank driver got shrapnel in the heart, killing him on the spot.
Standing beside me. That was a tough time, but you had a job to do, and you did it.
For the first time in over 20 years, he isn't at the National War Memorial.
Very disappointing. Every year I've gone to the War Memorial. Not this year. Just being there, sharing the memory with others. I can't do that now.
Like all years since the war, Spencer will take time to reflect.
I'll be thinking of the time past, people we lost, and the whole experience.
What do you want people to know about Robert Spencer?
Oh, just know that he was a nice guy.
Hannah Thibodeau, CBC News, Ottawa.
And we'll be right back with tonight's moment, a vet on why he just couldn't stay away from today's ceremony in Ottawa. But first, special messages from the next generation. Here are some Toronto students paying tribute this Remembrance Day.
I especially like Remembrance Day because I like remembering people who made this world safer for me.
They fought for us and they sacrificed their lives for us to live in peace.
I really want to say thank you to all their hard work that they have done for us.
My recipe for peace: 2 cups of love, 1 cup of friendship, 1 teaspoon of sharing, 1 pinch of family hugs. Mix together and serve to everyone.
So we showed you this striking image earlier in the program. George Slade, veteran of the Korean War, who wanted to see the Remembrance Day service in Ottawa. So he pulled up a chair to watch. Now, while hosting our special coverage, Chief Political Correspondent Rosemary Barton saw him alone taking in the day. Hannah Thibodeau caught up with him. Their conversation is our moment.
You felt it was important to come down here today.
Well, it's about the people that have served and are serving, as well as those that have passed away, died in battle or due to injuries after. We have got to honor the veterans, the ones that have been active in war, those that were available to fight in war, but possibly never got there, but they were ready. I came here because these people and the ones behind us. I appreciate taking part in it, but it's quite embarrassing.
No, we appreciate having you. I can't give you a hug, but I could give you an elbow. Thank you for your service, sir. It was my pleasure to talk to you.
What a wonderful moment, right? That you only really get in these live television situations. And I mean, he says he was embarrassed. He did also say that he appreciated the fact of being on television, but that it certainly wasn't his intention.
No, and he also told Hannah that he hoped his friends would forgive him for being on TV. Of course they would. And for the rest of us, we thank you, and we're all very sorry we couldn't fill the streets for all of you today. That is a national for November the 11th. Good night.
Good night.